For the longest time, the field of aesthetics only dealt with the skin. No one was dealing with the deeper issues. But if we go deeper, and if we understand the whole facial anatomy, if we palpate all the structures and understand how they change with age, and how it affects our facial features, we can turn the process backwards. A very common issue for the thinner faces is what we call cheek hollowing. During our diagnosis, it's very easy to notice these hollowings when we sit and diagnose in front of a mirror. But when a client is laying down, especially if the face is a little bit more round, it will be very difficult to see these hollowings. And then in order to identify these areas, we can try to move the tissues from the jaw edge towards the center, and we will be able to visually see these folds and hollowings forming right in front of our eyes. We can also try another technique such as this one and see the same hollowing. And these are the areas of adipose tissue thinning. And only then, and of course we always want to start with the side that has the biggest deformation and the issue. We have lifted our tissues and we can see the fibrotic formation. We always want to work on the thicker tissues first, and this is what we call the masseter roll that formed after the use of the masseter muscle. Additionally, we want to pinpoint the biggest hollowing area, and with a tweezer-like motion, we want to lift that area. We want to find the deformed adipose tissue within this area, which will always give sensitivity in these areas. And this is with the purpose to restore the blood flow and circulation in this area. We can use the split technique, and you can see this hollowing area right here. We have lifted it, and you can see even the pigmentation over it. We lift, rub, and stretched. Here, I feel this little chunk in here where we have this aggregation of the adipose tissue that we want to redistribute in order to fill in this hollowing area that has formed. And therefore, we continue working this way in this area. Do you see the little dimple? We push the area together, we rub it against each other, and we open it up. And you can see this little, almost like a star come out. Right next to it, we see another dimple of tissue that has been scarred together, and we open the tissue as well. Our goal for all the areas that have fibrotic scarring is to work that area from all the sides, to stretch, to massage, to rub, in order to soften this hard formed area that we feel right here, this big lump, which will lead to a complete restoration of the blood circulation in this area. The orbicularis oris muscle, I think right here we see its edges. The attachment of the orbicularis oris is right here. So how can we open up this muscle? What can we do? We can try to stretch or to pull apart the tissues in this area. Are there any specific directions in which we stretch the tissues? Think to how your eye closes. It's a sphincter. It pulls inward. So our goal is to actually stretch it backwards in the opposite direction. So in this area, we have a couple directions of the orbicularis oris muscle. For example, in this area, it stretches this way. Then also we have the frontalis muscle that goes into the orbicularis oris this way. And some people actually form pigmentation around the border of the muscle. So we can also stretch and work this way. Are there any sensitivity that you're feeling right now? No. Good. Today, during our seminar in Prague, we will work with the eye area. One of the most difficult areas to work in is the tear-through area and the border between the upper jaw and the lower jaw. We can move the tissues in a specific way to see where we have any dips that will form. And since we have already worked with this side, we can see that the dip is much lower here than on the other side where it is much bigger. And you can see it on the other side. So we will start working right on this specific fold right here on the side. Firstly, by massaging the tissue out, and then also working with the cartilage tissue of the edge of the nose. And we always want to check as we're moving along like this. We want to make sure the tissues are filling up. Moving along right here on the bone, I am palpating and massaging out these fibrotic formations. And I lift again and check for the fold. And we have one more demo of the intraoral massage or buccal massage on a so-called thinner or not a big complexion type of face. We enter inside the mouth and right away we can see these tissues falling in. They are depleted. And as previously said, with this tweezer-like motion along the fold, we want to activate blood flow in this area. Then we check, and then inside the mouth we want to open and push these tissues apart. Sensitivity? No, only when we entered intraorally. Okay. And again, I enter and I see this fold created. Again, we activate the tissues right in the fold and stretch and open out the tissues. So our goal with thinner faces is to work all of these hollowed areas and make sure that they are full once again. So again, our goal is to start our process not with the plus tissues, but with the tissues that are in the negative, that are depleted, and start working from those, especially when we work with thinner faces. And to help yourself along, we can provoke this fold in this certain specific way with the fingers. In this way we activate it, and then we will stretch out the tissues, making sure we're not sliding across the skin. Also activated from the inside, and also check it on the outside. And we keep moving up, and of course we have a lot of work to do in this area.